Alcohol continues to be one of the leading causes of death and illness in England. More than 1 million hospital admissions and 23,000 deaths each year are caused by harmful drinking, costing our NHS £3.5 billion and wider society £21 billion. The growing availability of cheap alcohol has fueled this problem. Alcohol is 60% more affordable today than in 1980, with supermarkets and off-licences undercutting traditional pubs to the point that 2/3 of drinking now occurs at home. Products like high-strength white cider containing the equivalent of 22 shots of vodka are sold for as little as £3.50. Our current alcohol tax system, branded a mess by the Institute for Fiscal Studies, perversely incentivises the production of cheap, high-strength products. For example, strong white cider attracts the lowest tax of any drink, less than 1/3 of equivalent strength beer. Moreover, recent cuts to alcohol taxes will cost the public purse £2.9 billion. The ideal solution is a minimum unit price, targeted at the cheapest products favoured by children and the heaviest drinkers. A 50p minimum unit price in England would save 525 lives a year. 80% of these would be from the lowest income groups. It would also reduce annual hospital admissions by 22,000 and cut NHS costs by £1.3 billion over 20 years. In Canada, a 10% increase in the minimum price for alcohol led to a 32% drop in alcohol attributable deaths. There's a groundswell of support for alcohol policy change. 71% of the public believe the government has a responsibility to address alcohol-related harm, while 52% support minimum unit pricing. Other UK nations are moving forward. Scotland is set to introduce minimum unit pricing, having twice overcome legal challenges from the alcohol industry. The Republic of Ireland is legislating for minimum unit pricing, and both Welsh and Northern Irish governments have looked at this measure. England should not be left behind. Let's take action on cheap alcohol.